Morning. I'll call to order the Board of Franklin County Commissioners meeting for Wednesday, March 18th, 2020.
Chair Waymeyer,
Present.
Commissioner Howard,
Present.
Commissioner Dunn,
Present.
Commissioner Dickinson,
Present.
Commissioner Stottlemyre.
Present.
All right, if you'd please stand and join me for the Pledge of Allegiance and remain standing for the invocation. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. I want to start with a quote from Martin Luther King Jr. He said this: "The ultimate measure of a person," and I want to throw in community, "the ultimate measure of a community is not where they stand in moments of comfort and convenience, but where they stand in times of challenge and controversy." And I think that rings true for where we're at right now. Let's pray. Lord, we've heard a lot of people saying we're in uncharted territory right now, and I think that's true. And I pray that we would all just be able to work ourselves through this thing, and as a community, that would happen. Lord, I'm praying we can't control what's happening, but I think we control how we respond to what's happening around us, and we can do that with a positive attitude, with obeying the things that we're asked to do, taking care of all the things that are going on around us, and we're thankful for what you've given us. We're thankful for the things that you've given us in the Scripture. You've told us in 1 Timothy, God has not given us a spirit of fear or of timidity, but a spirit of power, love, and self-discipline. And in Proverbs 22, and this is what I wanted to pray for our commissioners this morning. So Proverbs tells us a prudent person foresees danger and takes precautions, but a simpleton goes blindly on and suffers the consequences. And of all the things that are canceled around us, we know that hope is not. Hope is still alive, and we can have that hope. And I pray that as a community, we continue to share kindness and compassion and humility amongst ourselves. And we do want to pray for our county. We pray for our commissioners for wisdom, for all the folks that are part of our county, all the departments, that they would use wisdom in the way they carry out their jobs in these days, and just protect them, watch over them, keep them well, and just keep them in front of us. We want to pray for parents. Yesterday, we got the news that school would be in school. Things would be shut down for a while and trying some other things. But we pray for parents who will be home trying to juggle what's going to happen with kids at home and getting to work. We pray for them. We pray for those parents. We pray for the children. Many of them probably just don't understand what's happening, but teachable moments are there. So give us wisdom on how to share with our children, our grandchildren, what's going on. We pray for our elderly, who we're being told are more susceptible to all this. We pray for them that they would stay safe, do the things they're asked to do, and that they would stay safe. Continue to watch over them. Pray for our local businesses who are going to be hurting a little bit, maybe through all this, with things closing down, slowing down a little bit. We pray for them. We pray for our churches, the people of our churches, most of them, many of them not meeting in a building, but still being the church, and we pray for them. I want to pray for our first responders. I do every day, but Lord, especially in these times, I want to pray for our first responders, for our sheriff department and the guys out on the road, for our police department and all the things that go on in Ottawa. We pray for our EMS people, our dispatch folks. I want to pray for the doctors and the nurses. They're up to their elbows literally in all this stuff, and we want to pray for their safety and them to watch over those. I pray for all the folks that serve us, the folks around us that are taking care of us. We thank you for them. And above all else and all that's going on right now, I pray that you give us peace and help us as we work things out. Again, pray for our county as today they meet and they use their wisdom and put all their heads together to do the right things. We pray for them. And Lord, we thank you for your guidance and direction always. In Jesus' name, amen.
Right. Good morning. Appreciate everybody keeping a safe distance between each other, being considered your neighbor. We'll get started. Correspondence and organizational business, Derek? Nope. Brings us to our public comment. Nope. Consent agenda today would include March 15th claim vouchers in the amount of $613,916.68. Tax change orders in a positive amount, $423.20. Commission meeting minutes for March 11th, 2020. And to consider participating in the Douglas County Highway Salt bid for 2020. That's our consent agenda. Is there a motion to approve it?
I'll make a motion to approve the consent agenda.
Is there a second?
Second.
Commissioner Howard,
Yes.
Commissioner Dunn,
Yes.
Commissioner Dickinson,
Yes.
Commissioner Stottlemyre,
Yeah.
Chair Waymeyer.
Yes. Our first item of business today is to consider approve extending the resolution for the public health emergency disaster declaration for 60 days.
Good morning.
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 So I've got before you a 60-day extension. On Saturday, we did a declaration of disaster for the COVID-19 public health emergency. That is a 7-day declaration, and in order for an extension, we need to have a resolution that will extend that to keep us in a emergency declaration. When talking with Derek, I will give an update during staff reports after we get done with the business as to where we're at.
I think what I would like to do is let David get through his items, and then we can start the discussion about the county's response to COVID-19. I have several staff members here who I would like to speak a little bit, including Alan, Midge, Chief Robbins, and myself. So I would ask that we approve this resolution, and then we'll come back to this topic.
Righty. Well, I think we all know why we do disaster declarations. Opens up other resources and allows us to change some of our policies to adapt to current situation.
That's correct. It enacts our emergency operations plan, also provides assistance from the state and from our federal partners. And I could see this probably being extended again if necessary. If not, as the resolution states, we can come together again and cancel the resolution at any time. So,
Would someone like to make a motion to approve the 60-day resolution extending the public health emergency disaster declaration?
I'll make the motion.
Like second it?
Second. Second.
Commissioner Dunn,
Yes.
Commissioner Dickinson,
Yes.
Commissioner Stottlemyre,
Yes.
Commissioner Howard,
Yes.
Chair Waymeyer.
Yes. My computer's completely froze up, so I'm going to go by memory. The second item is consider purchasing a 2020 Dodge Durango for the Emergency Management Department.
yes, this item was included for our 2020 budget, and I've received a couple bids. I went out to Victory Chrysler, received a bid from our local dealership, and then also using the state contract bid, which is Davis Moore out of Wichita. And I would recommend that we accept the Davis Moore state contract as the low bid.
Any questions for Alan? Would anyone like to approve the purchase of the 2020 Durango? For his-
Quick question. You said the Davis Moore out of Wichita, they were that much better than anything in this area?
Yes, there's about $600 difference between Victory Chrysler and Davis Moore.
Anyone like to make a motion to approve the purchase?
I'll make a motion for the approval.
Approval for the low bid, is there a second?
Second.
Commissioner Dickinson, Commissioner Stottlemyre,
Yes.
Commissioner Howard,
Yes.
Commissioner Dunn,
Yes.
Chair Waymire.
Yes.
Thank
Third-
you.
Thank you. Our third item of business is consider for approval chemical bids for 2020.
Commissioners, I'm going to let Pat Campbell, our lead director, come up and present the next two items, actually.
Good morning, all.
Good morning.
Morning, Pat.
You should have a sheet in front of you there for the chemical bids for 2020. Van Diest out of, well, the closest warehouse out of Iola. They got 5 of the 7 chemical bids for low. Another company based out of Colorado got the other 2. We would like to suggest if we could just, for simplification and timely manner of deliverance, or delivery, if we could just have Van Diest be awarded the whole contract. There's a difference of $480, $90 if we are purchase all the chemical on the sheet. We're not locked in all this chemical right now, and we have plenty on hand to get started. So, but like I say, this is we can buy up to this many ounces or gallons at this price for the year.
On the pasture guard, there's a 5-cent difference
Yes.
out of $85
Yep.
a
That's,
unit,
yep,
and then
5 cents a gallon.
then 9 cents on the escort.
Yeah, the escort's 9 cents an ounce.
So not big difference.
No,
It's
like I
just
say,
the
for-
volumes that gets us up to that.
Right, exactly. And that's
Most of the-
if we purchase all that.
Most of this will end up passed through selling to the general public. So it's
exactly.
not going to cost us $400 tax dollars.
Nope,
Just,
nope, not at all.
you okay with that, Derek?
I am.
All right.
If we end up not going with the low bid, do these people stop sending bids if they realize that they had the low bid, then it wasn't chosen? And that's the one thing that you don't want to happen, because you don't want to end up with only one supplier.
Exactly, yeah, that's correct. I don't think they would stop sending bids in, as far as, like, say, as far as the other company had the 2 low bids. We've had in past, I mean, granted, I'm new here right now, but I was here previously 4 or 5 years ago, so I know that the company that has the low bid on the other 2 chemicals, they are kind of slow. And a lot of times you'll have one person come in and wipe you out everything you have, and if we can't make a phone call and have it within the next day or day after, what good are we doing?
I think you run the risk of companies not soliciting or not providing bids when you make arbitrary decisions about why you're doing something. This isn't an arbitrary decision. I mean, we have good reasoning for why we're taking this course of action. I mean, if I can think of a lot of scenarios, Commissioner Dickinson, where that would be an issue. This isn't one of them.
Maybe they'll come in with a lower bid next time.
That's exactly right.
All right. Is there a motion to consider awarding the chemical bids to Van Diest, the noxious weed department?
I would make that motion.
I'll second.
Commissioner Stottlemyre,
Yes.
Commissioner Howard,
Yes.
Commissioner Dunn,
I'm going to vote no, because I think Derek's comment were pertinent about not taking low bids on,
Commissioner Dickinson,
Yes.
Chair Waymire.
Yes. All right. And then our fourth item of business is consider approval of the annual noxious weed report and eradication report.
And what this is a required state reports that you guys sign every year. It spells out what our plan of action is as the noxious weed department, how we do it, what we're using in the coming year, and then also gives the dispersed chemicals from last year that we report back to the state, and approximately how many acres that we're infested with each type of noxious weed. And, is it, on our ground or private land, it's broke out. Like I say, so it's a yearly required plan that we're mandated by the state to give.
That report is attached. Anything notable you want to highlight?
It was interesting, this is the first time I've put this plan together. I had a lot of help from Peg, of course. It was very interesting. I rewrote this, a majority of this plan. I don't think it had been rewritten for verbiage-wise for I don't know how long. Just cleaned up some language, made it a little more, in my mind, legible. So, but it was a neat experience, and I just dove in head first, and Peg was there to help me, and we got through it, and it cleaned it up a lot.
Good deal.
Good job.
Thank you.
All right. Would somebody like to make a motion to approve the noxious weed eradication report and annual noxious weed report?
Approve it.
All right.
Second.
Commissioner Howard,
Yes.
Commissioner Dunn,
Yes.
Commissioner Dickinson,
Yes?
Commissioner Stottlemyre,
Yes.
Chair Waymire.
Yes. Thank you.
Thank you.
Our next item of business lies with the Public Works Departments for consider awarding the bid for the 2020 chip seal project to Vance Brothers in the amount of $890,476.32 for the CMK alternate cover material.
Commissioners, I'm going to throw you a little bit of a curveball here. Every year, we have a chip seal program. And last year, we modified it a little bit to cut down the lane miles because of some of the chip seal that we've done the year before. This year, no doubt, this 50 miles that we've bid needs attention. However, I think we need to take another look at the situation. I think given the current virus crisis that we're under here now and the unknowns that are coming down the road, it might be a good time to step away from that. And the reason is, if we lose any time here with our ability to get out and prepare the roads, we may not be able to prep these 50 miles of road in time for the chip seal. And so what I would like to do, I would like to discuss doing, is postponing the chip seal program for this year and utilizing the dollars that we have allocated for that to contract our asphalt road patching. I think that with $900,000, we can get a fair amount of significant patching done and then kick off the chip seal program again next year. That will also allow us to focus 100% of our manpower and our effort on getting our gravel roads repaired and in better condition. Right now, we're expecting another couple of inches of rain today. That's going to exacerbate an already troublesome issue with our gravel roads. The asphalt roads need attention. There's a lot of patching all over the county that really needs to take place. If we have our resources, our limited resources out doing patching, we're not able to use those same folks on road repairs, culvert repairs, those sorts of things. So what I'm suggesting is that we step back from both the chip seal and the paint this year to concentrate on patching our asphalt roads using a third party. We would bid it out. We would identify the areas. We would go through a bidding process for that to establish that project. That would not take any of our resources. The traffic control and those sorts of things would be provided by the contractor, allowing us to work on our gravel roads, which are, many of them are in desperate need of attention. That'll allow us to focus on rebuilding and repairing the areas that need to be repaired. Not that we're going to stop doing that, but we only have so many resources, and I think given the circumstances and the possibility that we may lose time, I would like to dedicate as much time as possible that we have available to our gravel roads and turn the asphalt over to a third party.
How long is the bids good for?
30 days usually.
Oh, so we would have to make a decision within 30
Yeah.
days. Because if we could put it out for a little bit, things might be completely different in 60 days, you don't know.
Yeah, the cost of this, the prices keep going up by roughly 100,000 a year. So that leads into, maybe bigger discussions that will give us an opportunity, give me an opportunity during this time to analyze and come back with recommendations also. Chip seal is vital to our program. It's one of the cheapest methods of preserving our roadways, but you have to have, the asphalt itself has to be in good condition before we put the chip seal on top. And I just think that this year would be a good year to concentrate on that, utilizing the dollars that we have allocated for chip seal to make as many improvements as possible, and then get back at it next year.
Are you talking about all our roads or mainly just our roads that were on the list to be chip and sealed this year?
I'm hoping that, last year we did $180,000 worth of patching in 4 different locations. I'm hoping that we can get a lot more, the worst spots countywide rather than just on that 50-mile stretch. And there's a lot of needs on that 50-mile stretch, don't get me wrong, but there are we have subdivisions that need desperate attention. Some of our other main thoroughfares have large sections that need to be addressed, and that takes time and that takes manpower to do, which we can do, but every person that we assign to that is coming off of a gravel road situation as well. So it's.
If we don't do chip and seal this year, what is the chances that next year we're going to have way more than 50 miles that we're going to need to do?
We are definitely kicking the can a little bit, but if we go in and patch the worst areas, it's going to end up in a better situation. Plus the immediacy of taking care of these worst spots. I think Sand Creek Road's got a couple of pretty bad spots that need to be addressed. So, and they're a couple of years away from getting chip seal if we stay in the same rotation. So it's, there's no ideal situation here that where we can address all of these things. I'm trying to put forth a plan that makes the most sense given our current situation.
I have a couple of thoughts to add. One, generally, it's not going to be business as usual here in Franklin County. It's not going to be business as usual anywhere for some time. This bid is probably only good for 30 days, but I suspect in 60 or 90 days, if this, COVID situation doesn't turn into what we fear it might, we can probably get a fairly similar bid. The timing may be different at that point in terms of when it can be done, but I don't think the cost will be dramatically different. The doomsday scenario that we are trying to avoid is, given the nature of public works and the fact that, our employees work in rural areas in isolation, that's not a department that's going to get sent home. The problem is we will have employees who contract this. And when they do contract this illness, they will be sent home. And I'm not sure that I've done a great job of conveying the importance of social distancing to my employees. And if we don't get that message across, and if we do lose spades of our workforce, well, the issue then is we're under contract for $900,000, but we don't have the staff here to adequately prep the roads. And so that, I think, is really what David and I are trying to avoid by taking a wait-and-see approach. By bringing a contractor in, we don't have a lot of prep work that needs to be done if we're just doing the patching this year. And if we do lose, a chunk of our people, well, we're not out the $900,000 at that juncture, so.
Right.
Oh, David, I'd still like you to look into getting us our own equipment to do this project in-house in the meantime also.
Yeah, that's part of what, part of what I will be doing. Last year, early on, I spoke with a couple of counties that were doing what they could to get out of doing that work. And then it started raining and, my focus was elsewhere. Just recently, I spoke with a couple of counties that think that it's one of the best services that they provide. And so I have competing information that I've gotten from reputable sources. But last year I didn't spend the time on it that I could have. Going this route, it is something that I want to explore, especially given the information that I just got within the last couple of weeks from a couple of folks that I respect, and how they operate their public works department. So I will be looking into that and bringing it to a study session where we can discuss it in greater detail.
All right. Well, is there a consensus to not take action on this item today? Does anybody disagree with switching our attention towards patching?
I don't disagree. It's just a bad situation. Nobody wants to be in this situation. I know the work that they did do with part of the CHIP money we held back last year did a lot of good.
I want to do
There's a lot of it out there to try and cover with that dollar amount.
Yeah. I just want to spend the dollars wisely, and I don't want to commit to something that potentially could be an issue down the road.
Lance Brothers, ever since I've been on here, has been one of the few that, I think it's been the only company that we've used for this since I've been here. They're normally really busy. They get to us when they can. I don't think this would affect them as far as coming back in the future. They're dropping a bucket to them as much as they do in a year or so.
Yeah.
I think they'll always be available to us. And they proved last year that they're more than willing to work with us when they were willing to come off of what we had talked about doing and drop down to half of what we were going to do. So I don't think it'll affect our in the future with them. And I think that sounds like a smart move to me.
I just want to do what's prudent.
I also agree with Commissioner Dunn. You know where I stand on. I've
Yes, sir.
all along felt that we need to do our own chip and sealing, but and I know you've looked into that, but I also would appreciate if you continue, because I think the counties around us that do it, I've looked at a lot of their jobs. They do a good job, and I think it benefits them being able to do a small section of road instead of having to contract 50 miles at a time.
There's positives, and there'll be things that'll be hard to deal with as well if we start doing it in-house, but I want to give it a good, honest look and bring the information before you so that we can make a good decision.
All right. Well, there's no action, so I don't know that we need to.
Yeah. I don't think we need one.
And this would go for the paint as well.
Sure.
And I'll provide letters to all of the folks that bid on the project, letting them know that we're stepping back at this time.
These will be full depth patches or build patches? So
Yes.
not like a leveling course or anything
No,
like that,
these,
where it probably won't last the winter? It'd be-
Yeah, no, these are full depth patches that we're talking about, just like we did last year on Rock Creek Road and, Nevada and those.
Okay. righty. That brings us to staff reports. Did you have anything for staff reports, David, while you're up here?
I would just, let you know that we are hauling rock and trying to take care of the worst spots. Ordinarily, we like to send, 5 or more of our rock trucks to a particular location in an effort to minimize the harm to our roads by just getting the gravel to these locations. We're bumping that down to 1 and 2 trucks and just taking care of small spots and trying to make things a little bit better. We're going to be fighting this for quite a while. If it keeps raining, it's certainly not helping our situation. But we are doing the best that we can at this given moment. So we haven't stopped operations, and we'll continue working just as hard and fast as we can.
What order would you like to go in, Derek? Sounds like you had something in mind as far as before we start our big conversation.
Yeah, I can quarterback it if you'd like, Colt, and I can start the conversation by talking about some of the issues we're having with this. And if you've watched the news at all, and look at what other countries have done and those that have handled it well and those who haven't and where it's gotten out of control, as a country, we weren't prepared for this. Our federal government wasn't prepared. And our state government wasn't prepared. And so that makes it incredibly challenging as a local government to be prepared for something like this. And so we're operating under that framework. The guidance that we are receiving on this is constantly changing. I mean, it changes every single day. And so the challenge that our team is facing is, okay, when do we want to implement policies? When do we want to make recommendations? Because what we do today may very well be undone tomorrow. So many of the things that, when I think about like the health and well-being of our employees, so many of the policies that I would implement have to be implemented by this board. At least they would in the normal course of business. And it's not good for the health and well-being of our people for me to call you guys in here every time that we have, a policy that we want to update. And so, it is an incredibly challenging situation to respond to. I've told you all this via email, but we've got a very good team that is quarterbacking this response. I mean, Lord knows, Midge Ransom has worked tirelessly. Alan Radcliffe has worked tirelessly. Nick Robbins, Casey, myself, like we're doing everything we can, but this is an impossible situation to stay on top of. So what I would like to do today is let Alan and Midge give you an update on what we have done thus far. To the extent we can, give you a prognosis of what the next days and weeks may look like. And then I want to talk with you about what Sari and I have been discussing with regard to our employees and how we're going to take care of them as this becomes a bigger issue, which I think we all believe that it will. So with that, I'll bring Alan up. And Alan, if you want to talk about where we've been so far, and then I'll ask Midge to kind of supplement that.
Good morning again. I just want to thank everybody to start with for following the recommendations and guidance we have so far, and including our citizens. As Derek said, this is kind of an unprecedented situation that we're in. We've had a public health emergency before that we've worked. It was, if you don't remember, is about 11 years ago. Wasn't near as serious as this one. And I just want to make sure that everybody understands the seriousness of this incident and some of the implications that could could occur, and we have a lot of unknowns that we're looking at as we go down the road, too. They're also looking in things getting worse for us, but also it could be a long duration for us. And I know we extended the declaration. I just want everybody to understand that with that declaration, I'm going to talk about money for just a minute before I get into where we're actually at, but what the declaration will consist of on the money side currently. On a normal declaration of disaster, now this is a public health emergency, and some of the guidance is going through the federal HHS and then through KDHE at the state levels. So there is a little bit of a difference on handling some of this, but when it comes to funding, I can see this being a very expensive incident and disaster for us. Don't have any idea of the cost, but I think it's going to be expensive for everybody at the county level, the state level, and at the federal level. County level, we need to meet $100,000 of approved expenses on a normal disaster to be able to declare for federal funding or for state funding. At the state level, it's $4.3 million. And then when you get up to the federal level, it's a 75% cost share. So we're still looking at 25% of those approved costs being on us, unless the state, which they generally do, pick up 10% of that. So we still have 15% that will be our cost. And that's just on approved. Now, there may be some things that we do that are not approved for expenditures. Those are decisions we'll have to make at the local level, as Derek said. So with that being said, we've been watching this COVID-19 public health emergency for quite a while. The health department has been watching it. We did a briefing with all of the EOC partners, and I will talk about EOC's Emergency Operations Center for the county. ESF's, if I throw that in, that's an emergency support function in our plan. So we met with all of our partners last Monday and gave an update. We started meeting, Derek and I and Midge met a couple times last week. We have a core group that we've brought together. Nick with EMS was involved. We've had the sheriff, we've had the fire departments in. The way our structure is currently set up, this is a public health emergency. It's under ESF 8, which is health and medical, and that is Midge and Nick's departments, and they are both primary and secondary leaders in ESF 8. And really what we're doing is supporting public health. Now, for the other emergency support functions that are activated currently is emergency management and resource support. Those are under my department. We've already activated at a partial activation with those ESFs. We worked through the weekend. On Saturday, we did the declaration with the county commission chair. We had meetings with our first responders and went over protocols. And if we need to, Nick can go on and talk about what he's doing. I've asked Nick to be the lead for our first responders to make sure that we get proper PPE and proper protocols and procedures for those in place. We had another briefing this Monday, and with some of the guidance coming out, our meeting numbers are getting smaller. And as Derek already mentioned, the guidance is coming out continually. It's changing daily. I got some updates today. There's some things that we did over the weekend that are now governor's executive orders. One of those is closing the schools. Now, when we talk about closing the schools, that is the buildings that are being closed. If you read that executive order, the building is being closed. It's going to be a challenge for our school districts and for our parochial schools and even the colleges because they're wanting remote learning. So it's not that the school year is canceled, it's that the buildings are closed. And that we can maybe see some changes with that. If you'll read that executive order, it lists some things out in there. So I just want everyone to understand that. The governor has another executive order that came out a couple days ago on public gatherings. And again, this was guidance at the current time, and it was no public gatherings of 50 people or more. On that same day, the federal CDC guidance came out of no public gatherings of 10 or more. So it's not just events and public gatherings, it's groups of people. We want to try to limit it to 10 or less. Everything that we're trying to do at the local, state, and federal level is social distancing.
I'm going to jump in there. That is something that we have to take seriously. Like, there is a reason why I have put 6 feet of space between all of you today. Like, as a government, we have got to lead by example there. We have got to ask ourselves, you know, guidance from the White House, from the CDC says we recommend no more than 10 people in a meeting. So something that Alan and I have talked about is, you know, we ask, is this person's presence at this meeting critical? Like, do they have to be here in order to effectively do their job? If the answer to that question is no, then we ask them to stay in their office. Because if we can't even do it as a government, then how can we expect other businesses and citizens to do that? So I will continue stressing to you, to my staff, that if we don't need to be somewhere, and we're doing this on our level, like we're literally trying to quarterback the community's response to this event. But if we can bring somebody in via video conference or teleconference as opposed to meeting face to face, we're going to do that. I mean, I think it's incumbent upon all of us that we practice this. Like, these are recommendations for a reason, and we're watching all communities around us begin to do it. So it's something that I would urge that we take seriously.
But to go along with that, it is common practice for our EOC to have multiple people in it. We stressed on Monday that I only want a core group there. And this was even before the guidance came out for just 10 or more in a group. We're still working as to how we can do some of this video conferencing, some of our conference calls. There's probably going to be the need for 2 or 3, 4, 5 people to get together at certain times and have some meetings. We're trying to limit that as much as possible. I stressed very strongly with our community partners on Monday, I only want one person to be at any meetings, and then they can pass that information on by email or phone call, however they want to do it, getting it out to our other partners. Communication is going to be an issue for us, and we're trying to work through that. Again, this is unprecedented. It's not the way we normally operate, and we got to keep that in mind. We're going to have to keep an open mind and come up with some solutions on some of these challenges that we have, and I'm confident that we can do it. But we may even have to think out of the box on some of these things as we go down the road the next weeks and months. With that being said, one addition, yesterday, before I turn this over to Midge, yesterday we had a request for our mobile tower trailer, our communications trailer, to go to Miami County. The state has had a tower trailer over there for the last few months because of their radio system issue. They had to pull it out and send it somewhere else yesterday about 5 o'clock. So Tom took it over last night, and we've got it set up so that's a regional asset, and that piece of equipment is supporting Miami County right now as part of our partnerships as we're working. With that, I just want to add that, again, I want to thank the citizens, the businesses, our healthcare providers, our first responders, and everybody else that's working. with us during this incident, and everybody please take things serious and take precautions and follow the recommendations and guidance. It's out there for a reason, and there's a lot of information's out there. Casey's done a good job of putting out public information, and that was a discussion I had yesterday with Dustin. If it wasn't for Casey being here, Dustin and my office would be trying to do that, and we wouldn't be doing near as good a job as what's been going on, and I can see that continuing as we go into this. Have anything else?
Right, rainy morning. Trying to remember to put my hands in my pockets so I don't touch what Alan just touched. But in all seriousness, that's what we all have to do. So I'm serious about that. Just to give you an update, I want to briefly go back through the phases of public health response. The first phase that we started way back in January was learning what was going on in China, because we knew that is a potential outbreak with an emerging disease. So we started following that way back 1st of January, as soon as it broke in the news, to know and learn as this goes on as much as we can learn about the disease, its transmission, how it affects the population. So that said, that's phase one. And during that phase, we started pulling guidance and sending it to all our partners, trying to get them ready, prepared for the phase we're currently in, making sure they reviewed their PPE, their practices, their policies for closure, all of that. We worked with all kinds of agencies during that time. Now that we've moved into a very active phase, phase two, where we have a triage unit set up in the health department so that we're accepting those calls, triaging those calls, illness calls, to determine if we can test or not be able to test that individual. The testing guidance is changing, and I hope is very soon more open than it has been. But so far, I think in our community we've done okay with that. We've been insulated somewhat being outside of the metropolitan areas. That helps us. But if you look at the epi curve that everybody talks about, trying to avoid that peak, what typically happens in rural areas is that peak comes way over here. The problem with Franklin County is we're kind of halfway in the middle between rural and urban, so it's harder to determine where that peak's going to hit for us. So you have to measure your response based on where you anticipate that peak to avoid that peak. So that's what we're trying hard to do. As things have heated up in the metropolitan area, we certainly are respectful of all the guidance that the state and the CDC gives us. That legal structure, the state overrides the local in this particular situation. CDC can issue orders that override the state. Their orders have been guidance at this point, but nonetheless, rather than a strict order, but nonetheless, we want to pay attention to that. So we are actively testing, quarantining, and isolating individuals. We have continued to be in good shape at this point in time. We're looking at when to start releasing some of the numbers. I'm not just releasing one number. So we're looking at when we can release the number of people under investigation, and hope to have that decision later today, which I hope will help the community in the long run. Before I talk a little bit more about that, I just want to say the next phase, as we're moving, so this active phase in public health, the tools we use are isolation and quarantine and monitoring. Those are the things that we can use to separate people legally from the rest of the community for the time period for which they are able to expose someone else to the disease. We have been very pleased with the response and the cooperation we have gotten from everybody we've isolated or quarantined. Every single person has paid attention to that. So we appreciate that very, very much. At some point in an event like this, That no longer works because you get once you get widespread community infection rates, one, there aren't enough people to do all that tracking and all those orders, and two, you never catch up with all the people that are infected. So that phase kind of goes to the background, and we have to move into the third, excuse me, the third phase of public health response, which is really supporting the community, making sure health needs are met, working with community members to make sure people have food. Hence the ban on shutting off public utilities. You can't shut the water off to people. I don't care if they've paid or not. We need them to be able to wash their hands. So we're in that phase now, building community response efforts, working with the organizations to see how we can best support the community members who are going to be potentially temporarily at home without a paycheck, or are unable to pay their rent, or can't put food on their table, or need medications and they can't go out of their house, or. So Erin Laurie is the person we put in charge of that community collaboration. She's been working on food assistance and ways we can do that in a social distancing manner. So that's just the next phase we're moving into. So we have to be prepared to support one another in the community as those needs. But we also have to be able to do that in a manner that is safe, as Derek says, to limit that close connection. So that only makes sense. So the community, as we have tried to educate them, give them guidance on protecting themselves and anyone they come in contact with, like the big businesses that have people coming through, clerks. Casey and Brenda and their staff have done a great job working with the businesses to get them to enforce those personal protective behaviors that protect us, like sanitizing their hands between people, keeping surfaces clean, all of that kind of thing. That has been critical. I will say, unfortunately, in an event like this or any other event, there are those individuals who seem to think who don't take it serious and don't perhaps realize the significance of their actions. So we have had calls from people who said, I need a test. We can't give it to them they don't meet criteria. Go out and tell other people that they're positive, and then we get calls from those people. And then we have to screen them. Those kinds of pranks, and that's just one example, those kinds of pranks are intolerable. We don't have the workforce to deal with the extra load that causes and the distress that it causes for individuals in the community. So I would urge everyone, including every community member, to take it serious, not panic, but just take it serious. And if you hear of people doing pranks and funny, what they think is funny, to help educate them about why that is not funny. So that's the backside of what we're seeing right now, and we're doing everything we can to publicly to try to calm all that down. Actually, the way this is breaking across Franklin County is pretty much what we expected it to do, with cases in Kansas City slowly filtering out our way. That's what we're seeing, and the timing is about what we expected. So we've been preparing for this all along, and so hopefully we're doing everything we can at this time. I just want to reiterate again what Alan said. That community support from my discussions with the schools, the businesses, everyone who has called for further guidance or clarification have been so cooperative. I cannot express enough appreciation for the positive actions I've seen throughout the community. Questions?
I got a question, Midge. When does one's personal privacy get trumped on a situation like this, and I'm referring to the one presumptive positive that we have in Franklin County. Now, none of us know who that person is, so we don't know if we were in the same venue where this person was.
So-
And I see a problem with that, because does that mean everybody might have been in that same venue, so that everybody does self-quarantine at that time, or?
So that is an excellent question. I'm very glad you asked that, because it brings to mind something we need to help the public understand more clearly. When we have a case, our investigation includes identifying every direct contact that someone has, and if necessary, the contacts those people have had. So in other words, it can filter down and get broader and broader, which one investigation on one person took us 6.5 hours to complete, just the initial investigation. I mean, that's how time-consuming this can be. So you're building out from the case to their immediate contacts, and potentially, depending on the stage of the disease, when the symptoms started, when they were exposed, everything we learn about that case, to broaden that to a wider situation. Everybody that is a contact direct is quarantined under legal order. They are quarantined. They can't go out, okay? So if you were a direct contact, you would know it from us, okay? If somebody feels like they were missed because they happened to find out who we're investigating, then they need to contact us so we can help work through that and find that out. You know, if somebody wasn't truthful with us. But people typically are very truthful. The outer ring of that investigation includes where were you in the last X number of days, and in this case, the time period, look back time period is 14 days. So here's where a symptom occurs. We first identify someone has a disease. We have to look back to potentially where that person acquired the disease up to 14 days, because that's what we're using as a model of incubation for the disease. So we'll look back, and then we have to look forward to, we have to stay looking back. Okay, where all have you been publicly? Did you go to the movies? Did you go buy groceries? And if we find there someplace where there would be that really close contact and risk of exposure, then we will let that be known. If you don't hear anything from us, it's because it wasn't a risk. And that's probably the hardest thing, and probably what we need to do better is make sure we know with this particular case, there was no identifiable risk in this community or in this community or in the, so we probably need to do a better job on that. At some point, and that's why it's called community-wide acquired infection, is at some point it is impossible. Too many people have undiagnosed cases, so it becomes impossible to know where people are picking up that disease. That's when social distancing, as we are in now, as a preventive method actually for us, is so important, because we can no longer trace that. It's just you don't know where they got it. They've been all of these public places. They haven't been on an airplane. They haven't gone anywhere. You just can't identify it. And that's community-wide acquired disease, and that, then you just got to stay away. We're seeing that move. And it moves rapidly. I mean, you all know that. So, thought I had another thought. And I don't
We're
know
seeing
what it
that
was.
in Johnson County. We're not seeing it here necessarily.
Necessarily.
Yeah, not confirmed. We don't know, but yeah.
Yeah, with as many people here's the thing. We knew spring break was coming. We knew people were going to travel. We knew it's spreading throughout the country. We know they're bringing it back. So the bottom line is, even though I wouldn't say today that's what we have right now, I would assume
Assume we're there.
it's here, okay? Yeah. So that's why we need to practice protection. And if for no other reason, if people don't care about themselves and they're not worried, because some people just don't worry, and maybe they're isolated out in their home and they don't see anybody. But protecting our healthcare workers, you've heard it on the news, if we lose them, we're done. We don't have enough healthcare workers. We cannot afford to lose a single one of them. And I'm here to tell you that I have relatives in another part of the country on the front lines in the ER that are already exposed. So that threat that we would automatically lose our ER personnel is critical. If people don't understand, they need to call before they come so that physicians are prepared to receive respiratory disease in a protective fashion. They better learn it now, because if we lose our healthcare professionals, we're seriously in trouble. So,
This 14-day self-quarantine or quarantine, it can be repetitive, can it?
if there was some reason to believe that they were re-exposed, but we don't release people from quarantine or isolation unless we're confident that that's okay to release them, okay? So remember, in definition-wise, that quarantine means the person does not have known disease, okay? So they're not infective to someone else. But we also know that there's the potential to not recognize disease, in this case with very mild disease. So hence we keep them quarantined until we're sure that if they had been exposed or they were suffering any disease, that they would remain separated from the rest of the community. So that quarantine period is typically 14 days, but we can reevaluate that. Isolation is if someone has symptoms and we've diagnosed, tested, know they have the disease, they have to be isolated. That's more intensive. They can't be around family. They can't be around anybody. There's special procedures for that. And the recovery from the disease determines, there's time frames for the recovery from the disease that determines release from isolation. So those two things. Other questions? Hang in there. Go community team. We are a community team, and thank you all for cooperation.
All right.
Before we transition to what we need to do as an organization, and Midge has already obviously got places to be, and that's certainly understandable. Before we make that transition, do you have any more questions for Alan? You have questions for Chief Robbins, Sheriff Richards?
Podium, please. Everybody can hear you. I've been kind of watching a lot of the other counties and minutes and so forth, and one of the concerns is, do we have something in place if you or Tom are not available?
We've discussed that, and in our county operations plan, it goes to Derek. And then
And
its
what if
ultimate
he's not
responsibility is the 5 of you.
Well,
If there's a majority available?
And that is a great question, Don, and therein lies the importance, and I know I'm hammering it hard, and it is intentional, of social distancing and being cognizant of where you're at. Like, we cannot afford to lose Alan. We cannot afford to lose Nick. We cannot afford to lose a core group of people, and so we need to be cognizant. I mean, we are personally responsible for how we present ourselves, where we go, what we do to ensure that we don't become infected. But everything that I'm going to talk about here as we move forward it's about preserving the health of our employees, because Nick goes down. If we lose our paramedics, here's the issue, Don. Think of a conventional disaster like a tornado. If a tornado hits Franklin County, Alan can get on the phone and he can call contacts all across the state, and they will be here to help. The whole state is being affected by this. So if we lose our paramedics, it's not as easy as us picking up the phone and being like, hey, send us paramedics, because everybody needs paramedics. And so it is paramount that we do what we can to ensure the health and safety of our employees. And there will be a point, Don, where we
I
just,
didn't mean that to mean a bad thing. It's just that you guys have the weight of the whole thing on your shoulder.
we do.
And you guys are the ones that are meeting, and if one of you has a problem, probably all of you have a problem. I don't know how you prevent that.
Well, and we are taking precautions too. We're wiping down every surface we can up there in the EOC 2 or 3 times a day. Tom and I have already started our COOP planning, our continuity of operations plan, so make sure everything, every email that comes to me goes to Tom also in case something does happen. So we're putting steps in place.
Thank you.
Anything else for Alan, for Nick, for Sheriff Richards? And I'm gonna have them stick around, so it's no pressure. I just,
Might ask Nick one question. Have your employees, not a bad thing, but just curiosity, have they listed anything that they have concerns about what they need to do proper, or what they feel maybe they ain't doing proper?
Are we not doing anything for them that they think that we should be doing?
I will tell you, we have done a lot of education. We've worked hard with getting the personal protective equipment. We've been acting for the last few weeks on what it's going to look like. We've got extensive response plans in place. We've worked with all the responders, wrote protocols, policies, procedures. We've had meetings with the fire chiefs, encouraged them to not freelance medical calls, to listen to dispatch information. We have put in place procedures when it comes into dispatch to identify potential cases over the phone where we're not sending the cavalry, and limiting the contact with these individuals. We've even put in place where some of these individuals may be routed for a triage prior to a response. So we're putting in things to help with the response of our first responders and our medical people. With that, I'm not seeing our responders being nervous, upset, concerned any more than they should be. So with that, I think we're well ahead of it. I think we're educating our people well and making sure we have the supplies we need. So I hope that answers the question as far as what we're doing and how we're doing it.
If they suspect and pretty sure of it, and maybe even the health department is pretty sure of it, do you go directly to our hospital? Or is there a plan to where you do go, is ours prepared for that, to come to their hospital? Or is there a plan that has to go somewhere else that is prepared?
The plan that we have in place with it, if they do need immediate medical assistance, we have a plan to route them into our local hospital. With that, we will decrease the amount of exposure from our people to the hospital staff by utilizing outside access through the decon room, which responders will not go into the hospital. The patient will be handed off in that controlled environment, and then we'll go through. Encourage them to walk instead of be on a cot. If somebody does need to go in and they are ambulatory, we're going to encourage them to walk. If they are not hemodynamically unstable or critical at the time of our response, we may encourage them to contact, be triaged, and maybe an alternative route into the hospital or for testing than going into a public facility. So the education points of what we're working on is to try to keep stable cases at home or potential cases at home instead of getting them into the environment of other people.
Thank you.
Other questions? Thank you.
all right. I need guidance from the board on what you would like to see in terms of county operations. As you know, we operate several buildings that are open to the public. We offer numerous services that involve face-to-face interaction with the public. And I want to start that discussion today. I would tell you that it's my intention, based both on what we know as well as what surrounding municipalities are doing. It's my intention today to recommend that we close our buildings to the public. That's not at all to say that we stop providing services. I believe we should continue to provide every service that we provide, but I think we should do so in ways that don't involve that face-to-face interaction. And I think about some of the services that the treasurer's office provides, and instead of coming in and paying your taxes, mailing your taxes, or making arrangements so that, you know, we can do it in some secure fashion. I will tell you, there have been so many employees that have been fantastic throughout this response so far. Dustin is certainly one of them as well. He has worked hard to provide sound solutions at a moment's notice, and he's doing a very good job of it. And so I believe in our ability to use technology to help both ourselves and the public to continue doing the things that we need to do. But obviously, I don't have the authority to say we need to close buildings down, and so I want to start that discussion with you. What are your thoughts on that? I will tell you, just today, the city of Lawrence has closed all of their buildings to the public. Douglas County has done the same. Anderson County just did this morning. Municipalities across the state are doing it. This is not considered an extreme measure given where we're at. I mean, it's surreal that we are doing this. I appreciate that. But given the circumstance, it's not like we're out ahead of the curve on this. And so what are your thoughts?
One of the things is when you go in to like get your tags, you can do them online, but they cost more to do them online. Can we do anything about that so that doing it in person or paying your taxes, you pay, if you use a credit card, it costs more? Or are you just gonna let people, just let them know that they need to do that?
Yeah, to the extent that there are fees associated with using our technology, I am reluctant to speak on behalf of an elected official, which obviously our county treasurer is, but I believe pretty strongly that to address your specific hypothetical, that Jody would be willing to, forego any additional fees for doing that.
The way we could,
I
yeah.
say on the credit card, it's automatically $1 or something like that. We don't have nothing to do with that. It just automatically does.
We definitely couldn't let people pay their taxes with their credit
Yeah.
card, because that would
They
take
do.
2% of a
Big
lot of
number.
money. Yeah. But
The governor is sending her, she's not closing her buildings. She's sending her people home.
Last night, I had a board meeting, conference call, ECAN. We did it with a conference phone call. And there was 5 other commissioners there on the phone line from Miami, Anderson, Osage, Coffee County. And they all said that they were closing their courthouses, but one of them, I can't remember which one, is saying their courthouse was limiting to one entrance, and they were restricting the people utilizing it to, there's somebody screening them there for a fever, then asking them a few questions about, like, have you been traveling, have you been exposed to anybody been sick, and that sort of thing. But most of them have the courthouses closed.
Commissioner Howard, you were commenting. What are your thoughts?
Oh, I agree that, like you said, that we're not ahead of everybody else. There's several others that already are doing this. For it, I think it's something that we need to take, and hopefully it's not for a long time, but Yeah, I definitely would be.
Commissioner Dickinson, what are your thoughts? Commissioner Stottlemyre?
I agree with it. The only thing, what would be your plan for this building? I mean, just our offices, yeah.
Yeah, so, yeah, Public Works, for example, we
Yeah.
would lock
Sure.
up their
Sure,
suite.
you-
But
I
no,
mean-
we're not going to restrict access, given the medical facilities in here.
Well, I meant, I didn't know if they was already closed already or not down at the fencing office. Have they already closed?
Yeah, they
Okay,
closed.
that's all. That's good.
Yeah, yeah. And then Colton, I don't think you've commented yet.
We definitely need to, I don't think we're to the point we can't stop providing service. I think it's imperative people still be able to transfer property. I see Pat, that's our building inspector. That's a huge industry, huge employer. We can't shut down that entire part of the economy, but I think we're just gonna have to, and there's no way we could, as a board, give you direction on every single department, what we think. So you're just we're gonna have to believe in you to manage it. But, making sure, for instance, back to, if we're doing an inspection, the person doesn't have to be there to watch us inspect it. People don't have to come in to drop off a piece of paper. We can use drop boxes, we can use mail, we can use email, electronic communications, do as much as we can by call, just encouraging. And we're definitely going to have to alter our operations, but there's no way we could. I mean, obviously, we have our emergency things, that goes without saying. We can't stop that, but we are kind of Grand Central Station for a lot of what happens in the community, the economy, people's lives. So even when we don't think of it as an emergency, it's still very important. And a good way to get people's buy-in on doing the important things is for them to be able to still function as still meet their basic needs and live. Directly, there's a lot of things we do here at the county that facilitate that, so.
I appreciate that. In terms of the closing, though, do you support that? If we continue to provide the services but close our doors?
Sure, yeah, yes.
Okay, and
This is something we can't afford to 2 weeks down the line be saying we should have closed.
yeah,
I mean,
yeah.
drastic step or not, but to me, it's something that you can't afford to look back and say, oh, I wish we would have closed them when we had the chance to.
I think it's important people know the service will still be available, so there's not a
Absolutely.
rush to do the wrong thing, and,
It's no different than what the schools are doing.
That's
And I thought
exactly
about that. So, because we closed our schools on Saturday, which was the same day that New York City closed their schools. New York City closed their schools because it was spreading, and they were trying to stop the spread. What we're trying to do is not let it start. And some people thought it was a little drastic to do that, but I fully support. We can't wait till it's here and then try to stop it. What we're trying to do is make it, yeah.
It'd be hard for a lot of our people to do the county's work from home because of the nature of our services, but
Yeah.
I don't want to see our employees having to use sick leave or leave just because we close down the buildings.
Well, and I think that's a good transition, Roy. And Colt, you kind of touched on this. That's the next issue we have. It's not practical, and candidly, I'm not so sure. I don't have this authority anyway, but I wouldn't want to exercise it without the board's approval or endorsement. We can continue to provide all of our services. That being said, I don't know that all 250 of our employees need to be here to provide those services. What I would like, and it's not practical for me to call a meeting with the board every time I feel like, we're better off just sending this group home. So, and we can talk about what Sari and I would recommend regarding leave, I guess, before you give me this endorsement, but I do feel like if this does continue to escalate, having that ability and knowing that you support that is important to me. I think it's important for the health and safety of our employees. Now, that being said, regarding leave, there is currently a federal bill that has passed the House. It is in the Senate this week, and my understanding is, as it is currently written, it would provide for 10 days of paid leave for all employees. And there are certain criteria that have to be met. I mean, obviously, it does relate to COVID-19, but my recommendation currently would be that even though that hasn't passed, that we strongly consider, providing that. So that is 10 days of leave before you even touch your leave balance. After 10 days, my current thoughts, and these are thoughts, I want to have this discussion, is that then we allow employees to start using their leave balances to, continue to take the time that they need. If you don't have a leave balance, then what we've contemplated is allowing you to effectively go into arrears. So we will give you up to 80 hours so let's say you're a new employee and you need to stay home. Okay, you've got the 10 days. Then we will give you 80 hours, but you are going to pay that back to us. So you normally accrue leave, 8 vacation hours, 8 sick hours a month. What we would ask is if you're 40 in the hole, that you pay that back on a monthly basis. If you choose to leave employment here before that is paid back, then the difference would be taken out of your final paycheck.
I don't like it.
Okay.
How's that gonna affect, sheriff deputies, your dispatchers, your EMTs and so forth, the ones that can't take off and really can't send home? How's that gonna affect them? Are they gonna get paid that 10 hours that others are getting off, or?
I think,
Where are we at there?
well, here's the thing, there is no group of employees that are not subject to this. If our dispatchers end up exposed in some way, they've got to go. And that goes and that's why we're going through great pains to try and I know what your thoughts are, Ian, and I appreciate them. So there is a notion that any employee who wants to take leave for any reason pertaining to this for whatever period of time, we need to pay them, I think is the problem.
I'm not saying that we should pay them if they decide, but if we decide to send them home, then they should not have. Now, if they decide that they need to stay home because they don't have anything else to do with their kids, yeah, then maybe they need to take leave. But if we ask them to stay home, then we can't say, and then you need to use your leave to do that. And that's where I'm saying that if it has anything to do with COVID-19, if we send them home, if they are under quarantine because they were exposed, if they actually get COVID-19 and they have to stay home, I don't think it should cost the employee any leave time. This is unprecedented, and we asked them to stay home, not because for their health, because they've already been exposed. We're asking them to stay home for our health. So otherwise, you end up with people coming to work sick. I don't have it. No, it's just, whatever, because they don't have leave time and they can't afford to stay home without pay. So we're not making them make impossible decisions. And that's one of the things that Midge said at our meeting, that employers that have employees that are hourly wages, who don't have benefits, living paycheck to paycheck, this is gonna hit them, and those are the people that are coming to work sick. And we don't want that. If you're sick, if you think you've been exposed, please stay home. And we are not gonna, it's not, I mean, that's my opinion.
Well,
And I don't know what you all feel, but
And, you know, if I've demonstrated anything in 5 years, I sincerely hope it's that I am pro-employee, and that the more we can do for our employees, the better. And I have thought about scenarios where employee thinks they're exposed, they're gonna stay home for the well-being of themselves and for everyone else. That's great. And I agree, we should pay them for that. The issue comes when, and I would like to think we don't have this many of these employees, but the fear is we have employees that are literally just staying home and getting paid for it, and we're giving them no incentive whatsoever, irregardless of their exposure level, to come back to work. Like, we have to have employees here because we have to be here for the citizens. We have to be able to perform these services. So that is the balance. We have to find something between employees not feeling like they need to show up when they're sick versus not just staying home for 3 months with no incentive to come back and getting paid every hour of it. Like, those to me are the goalposts that we have to stay in between, and it's not easy. Like, we've spent hours contemplating this, and the good news is we're gonna have to. We will make decisions that we will double back around and undo. I don't like it. I can't stand it, but that's the nature of the beast we're dealing with. So I think we've got to do what we think is best at this point in time, with the understanding that, you know, we may need to undo it. And so,
question for you. Are you considering sending home any employees that are not, sending home employees at this time, even if they're not sick? Are you considering sending home employees?
if I can get the message across to staff that it is important that we socially distance, that we stay in our offices, that we communicate via telephone and not in person, that we practice common sense measures to avoid the spread of a very contagious illness, then no, I am not currently contemplating sending anybody home.
Even though the government is sending, or the state government is sending all of their people home, because you can control what's happening at work, you can't control what's happening at home. You can't control where their kids were, or where their husband was, or where you can't control. You can control them at work, you can't control them out of work.
I completely understand that.
Well, there's a new dynamics with the schools being closed and our employees that have children that need supervision at home. It's another dynamics of this situation too.
What do you do with an employee who goes to someplace and then for spring break and comes back? Do you ask them to stay home for 14 days? Are you not going to pay them?
No, we're gonna pay them. I mean, that's literally the point of the policy that we are proposing. Like, we are giving 10 days, and we may have to come back and readdress this. In fact, I'm sure that we will.
Well, quarantine is 14.
But there are weekend days, Ian, that we're not.
Oh, I see, okay.
So, yes, if you have traveled, that's another thing that I plan to get to. If you have traveled and you are not under observation or guidance by the health department, then yeah, we are gonna ask that you stay at home for 14 days. But we are also recommending that we implement a policy that ensures you get paid for every single one of those days. My fear is that that is not enough. because I do think that this is going to last for, I think it'll be months before it's weeks. And so I do think that we need to come back and address it, but I don't think it's prudent at this time to have a more aggressive leave policy because we don't know for sure what's going to happen. But at this juncture, 2 weeks paid leave on top of all the leave that you have and the ability to use paid leave that you don't have in the event that you are a new employee or have, don't have a leave balance. But again, not saying that that's going to be the recommendation until the very end of this, but that is what we feel like anyway represents a balance of where we're at today. But I'm certainly, would love to hear thoughts from the rest of you on
It's
that.
kind of interesting, sitting there listening about the 14 days or whatever days it is. It's kind of interesting that somebody could say, well, you know what? I'm taking off a week for spring break and I'm going to go to another state where this is prevalent, and then come back and tell the county, well, guess what, guys? I went to Florida for spring break. Now I got to stay home for 14 days because I went out of state, and we'll draw 14 days on the county now because I got to isolate or quarantine or whatever for 14 days. Well, my thought, well, you made the choice to go to out of state for spring break. Maybe that 14 days ought to be on you.
Every single scenario, it's unfair to somebody. That's unfair to us, and really your peers too, because you made a choice.
But what if it wasn't for spring break? What if they had a father that's dying in California?
I guess what I'm getting
Then
ready to say
you gotta,
is every scenario, you have to concede that it's going to be unfair to somebody. Or there's going to be a rub, I guess. Maybe unfair is not even the right word. So we're not going to find a perfect scenario. I think we need to come into this be ready to compromise. Will you explain what you threw out, just kind of as a starting point, because it's been a minute, and will you recap what you said?
What Sari and I, Sari being my human resources director for the public who's watching this, are recommending to the board, and this is consistent with what has passed in the United States House of Representatives. And this bill is in the Senate, and we anticipate it passing this week, that we provide our employees with 10 days of paid sick leave just off the top. Like, this is an additional benefit given the circumstance that we're in that we are providing. 10 days. That covers 14 days real time. We provide that to them. Once that has expired, then we allow employees to start using their leave balance, their sick leave balance, and or their vacation leave balance, and or their personal day for this, if they so choose. If you don't have a leave balance, or if you don't have 80 hours of leave, we will allow you, even though you haven't accrued it yet, we will allow you to use up to 80 with the caveat that you are going to pay that back on a month-by-month basis, so that we're not out anything. And if the employee let's say the employee's new and they have no leave, and they use their 10 days that we're giving them, and then they accrue 80 hours, and then they use another 80 that they haven't earned yet, and they decide they're going to leave, we will recoup as much of that as we can from their final paycheck. It's not a perfect answer. And what the questions you guys are asking are not questions that we haven't contemplated. There are no perfect answers. There will be no perfect answers. What we have to do, what I am asking you all to do, is try and find the best balance between the health and well-being of the employee and basic fairness and equity in a very difficult time. And so that is what we're proposing today, Colt.
Absolutely will be no perfect perfect answer for this. We need to abandon hope of that now. And as you pointed out, that maybe isn't, well, you had some concerns about our emergency employees, or, you know, but then again, if they were sick, they could use this too. I mean, it's,
But I didn't mean it that way. I mean, what I meant is there are situations where like vacation days, you know, we've had it worked in where like or if you give the normal employee extra vacation days, for instance, and these guys can't take the vacation days, you have to, you know, pay them or whatever, that they're not able to use the same as others.
But they're
I know if they're sick, they're gonna be out just like anybody else, but I just meant if you were, when we were talking the scenario, possibly just adding 10 days to everybody's leave, but they don't get sick, or they're gonna have that same 10-day pay or whatever. You know, I know there's no perfect thing, and I know that that's part of being in that line of work. I mean, a lot of times you don't get the vacation days others do, or get sick days, whatever, but,
you're not
one thing you
sick.
gotta keep in mind that the county's not dealing with an unlimited amount of money. It's not like we have a deep hole that we can just give out whatever we want to make everybody this better, so. That'd be something that we can afford to do too.
I want it to be fair, but I also don't want, I mean, obviously out of 250 employees, we're probably going to have some that come down with the disease. And I don't want it to be a financial burden to them. You know, some way we've got to support them as much as we can.
so you're not,
Look on, I've read several articles. I mean, some of these people that's quarantined on some of these cruise ships, some of them's been on there 30 days or more they've been quarantined, and they're still there, so. We talk about 10 days, but if somebody is testing positive, and knows how long they may be out of work.
to be clear, the 14-day sick time also includes just somebody out of abundance of caution, we're gonna tell you to stay home. And
Yeah, that would be,
We need
again,
to do that.
This is all open for discussion. I mean,
okay, so it's easy, it's black and white when somebody's sick, stay home, we don't want you around. What about when somebody traveled, and it's probably a good idea to keep them at home? What should we? What's the matter?
oh, I'm, Sari, why don't you can talk to the board.
Don't touch anything.
Good reminder. And I'm not 100% familiar with all the policies, but we also have a sick donation plan that employees have opted into that they can draw from as well. The other thing is we have an optional short-term disability plan through AFLAC, and we just send out an email to all employees just letting them know that they can sign up for that at any time because it's after tax. So that's another thing that, again, it kind of shifts the responsibility to employees, but it also gives them that opportunity to take some of that on themselves.
Let's put that on the table for later, because those are long-term after we're giving them, let's see, 60 hours plus this potential 5 days. So that would be like 6-8 weeks down the road, those things would kick into getting into the bank and the long-term disability, so.
Well, this is a short-term disability, so it's a 7-day waiting period.
Okay.
And if we give employees like the administrative leave that Derek mentioned, that would be 10 days, so it would take them into the short-term disability.
Okay.
So do we,
And-
oh, no, go ahead. Go ahead, you're finishing your thought.
That's what I was gonna say.
Sorry, the short-term disability. Because then that will pull in. But do we have a policy, or are we going to set a policy of where, if our employees go this place, when they come back, they will be under quarantine?
Well, yeah, I mean, I think that is a discussion that we need to have. If you, and I will tell you, my understanding, and I wish I had the email in front of me, City of Ottawa, I think Richard has instituted a policy that if you travel over spring break anywhere, you're on the sideline for 14 days.
It's just a matter, I guess, going with your proposed plan, I think we're generally all on board with, if you're sick, we're okay with, using these 14 days, just a matter of if you come back, do we want to make that apply to them? Make the 14 days available to them. If you've been on vacation, as for instance, and come back, I mean,
I don't think we can make the policy while they're gone and then say, well, when you come back, you aren't paid for 2 weeks.
I mean, that's fine. I think personally, I think we need to extend that to them if they come back. Here's this 14-day. I mean, yeah, does it kind of stink for the guy who didn't go on vacation? And, you know, yeah, it's not fair, but there's not going to be a perfect answer. And I think it's important to keep those people home.
I don't support not extending the 14 days or the 10 days to people, because you make a great point, Ian. We can't implement a policy after they've already left for vacation that precludes them from receiving pay. So I absolutely understand where you're at, Commissioner Howard. That being said, I would recommend that 10 days certainly apply, not only to if you're sick, but if you've chosen to travel and you are asked to stay home, that yes, that 10 days be available to you on top of your existing leave balance. That would be my recommendation.
Can we, though, move forward? Like, right now, you can get really cheap tickets to New York City. So our employees decide, I'm going to New York City this weekend, and then when they come home, and then they're going to be quarantined. I think moving forward, we're going to have to ask our employees to reconsider even trips they've already planned. Don't get on a cruise ship, please. You know, don't, until this, you know, make good choices so that we don't have to deal with the consequences of that. If you, like I said, if you have to go out of state for a family emergency, or, yes, that's a different, but moving forward, we have to, I mean, the same as social distancing, let's be smart about our decisions.
And I think that numerous employers have instituted policies that, and I'm not proposing this, but if you are going to travel for leisure, that you have to get approval from your employer to do that. I have no desire to do that. I have no desire to tell one of my grown adult employees, you know, you can't go there for a vacation. I don't feel like that is within my purview. That being said, what I would like to be able to say, to get to your point, Commissioner Howard, is if you go on that trip, I'm going to quarantine you for 14 days and I'm not going to pay you for it, because that is an obvious deterrent to doing that. So, yeah, I think if we implement this policy proactively, that if you travel for leisure, that time's not going to be available to you, I support that. But for those that are on spring break this week, it's not equitable to.
You talk about traveling for leisure anywhere, or just traveling for leisure?
Again, we would have to identify that. And
CDC is recommending any travel at this point, just.
Wow.
And the questions you were asking, and they illustrate a greater point. There are so many nuances to all of this. I cannot possibly, and I'm not sitting here, believe me, I'm not sitting here wanting this responsibility. I don't want it on my shoulders, but at the same time, it is not practical and it is not safe for me to call you all together every time Sari and I have a unique situation involving an employee. Like, this is an extraordinary time that is it's just gonna require measures that aren't typical. And so I do think that it is probably best if staff be given some discretion on how to handle these. I mean, the broader points that we've talked about and can hit, I think we need to, but as you're demonstrating, Ian, there's just a million nuances, and we'll be here all day and all night if we try to cover all of them.
I don't think we go into travel, honestly. I mean, what's travel? Is travel Johnson County? I mean, could be emergency things you need. There could be,
Yeah.
who knows what. Is travel Missouri? That's 30 miles away, is travel. So
I'm just thinking, so, this is personal, but it could be anybody. My husband has an 87-year-old father who he has not seen in 2 years. And even if we drove to New York to see him, or, I mean, if somebody had a situation like that where,
This whole public health thing doesn't work anyways if we make stupid decisions. If we're selfish, if we don't think of our family, our friends, the people in the community, it doesn't work. We can't make a policy internally to prevent that. We can't make a policy in the world to prevent that. If there's not buy-in, it doesn't work. So I don't think kind of the question before us, can anybody think of anything better than what Derek's proposed?
I think we start there and we change it if we need to.
I just wonder what's gonna happen when, an employee says, well, I gotta be home with my, grade school kids for 2 months until the end of the school year. What do we do then?
I will tell you, currently, I am watching that House Bill 6201 that I've been referencing very closely. That is a topic of national discussion, Roy, and I am anticipating and hoping that we get some guidance on that, because that is a very, very real dilemma that a lot of parents are facing.
Or anything better than what you proposed? I like that it brings parity with what's.
It's way too many angles. I know the state's even proposing a similar thing that you're talking about the feds are done, but they haven't put it in writing. But they're even,
Well,
The state is sending all their employees home under administrative leave, which keeps them to have salary and benefits. And they're not asking them to come in, they're just sending them home.
and we don't have that luxury, unfortunately, because so many of that's part of being, the local government being the first stop for everyone. We have too much direct interaction with the public that we've talked, I've sent emails and correspondence to my department heads, like they don't feel like they can do that. I can't just send large swaths of our people home. It's just, if we are going to continue providing the services, which my understanding is that this board supports, then we're going to have people here. What I would say is, again, this is not a particularly novel approach. This is not something that Sari and I have crafted up that no other government in this region, in this country. I would say this is the most common approach being taken by local governments, because it is modeled after what I think in a very short amount of time is going to become a federal bill that gets passed. And so I fully acknowledge this is not perfect. But we are not out on a limb here in doing this. This is what I would say a majority of governments are doing. And so I think, as you've said, Ian, we start here and then we see how the situation progresses. Now, that being said, that leads us to yet another issue. When and how often do you all want to meet?
You need to vote on that policy. Do you need anything? Sorry, but I don't want to come back to it.
No, I appreciate it. So let me tee it up, and Sari, Casey, you stop me if I'm misspeaking, and then we can call for a motion. I would ask that we implement an emergency policy that allows for 10 days of paid administrative leave for our employees on top of their leave balances pertaining to this COVID-19 illness, and that once that 10 days expires, if it expires, then we allow employees to use their full leave balances. For employees who don't have at least 80 hours, we allow them, even though they haven't accrued it, to use up to 80, but they will go into arrears or will build a negative balance that they will then pay back on a monthly basis. Sari, does that cover it? Casey?
I think we need, only other thing to add, a deadline, time frame. For instance, we're giving them 10 days as a benefit. How long does it go on? Until the end of the year? I mean, after that, does it?
It has to be COVID-19 related, right? Is that what we're doing?
Yeah, I mean,
So as long as COVID-19 is still an issue.
it's hard to cap it because of
I mean, we
that.
can extend it, but otherwise, you're just adding 20 hours to everybody, and 10 years from now, it's a, if we're,
COVID-19 related.
okay.
Yeah, if we want to say that the balance will, you know, I think as of now, if I were to say August,
We can push that date back,
but
but
can push that date back, I would say for now.
how
that
long are we extending the deal for? Okay.
We're extending the deal through August at this point in time, and that date can be extended.
I ask HR a question.
Yeah.
Okay, ask you a question. Clear my head on this. If we send an employee home at our discretion, are they eligible at a certain time that they're not receiving money anymore from us? Are they eligible for unemployment?
They are. And there are also additional measures that are trying to speed up that process. There's special phone numbers that they can call into to speed up the process for unemployment, and they're trying to extend the number of weeks that are covered for the employee for unemployment.
I mean, we're not laying them off, they're just lack of
Well,
whatever.
no, and that's a great thought, Don. It does effectively become a legal layoff, and that is part of this House Bill 6201, is it is reforming the unemployment system, given the circumstance, to allow for employees greater flexibility, greater benefit, and we hope that it doesn't get to that point, but if it does, then we're obviously not going to contest their unemployment, and so that is an additional benefit that would be on
Which
top.
that's an unforeseen at this time, but I think it's gonna happen.
I'm afraid you're probably right, but, okay. So, all right, do you have any more questions?
No, that was my main, just kind of put that out there, that there would be something else besides nothing, you know?
Yeah, no, yeah, that's absolutely right. So,
Everybody understands what Derek's kind of thrown out there and proposed, just outlined for us?
that's the case, I would ask for a motion.
I'll make the motion.
I'd like to make a second.
Second.
Commissioner Dunn,
Yes.
Commissioner Dickinson,
Yes.
Commissioner Stottlemyre,
Yes.
Commissioner Howard,
Yes.
Chair Waymeyer.
So, the next issue we have is how often do all of you want to meet? Because these meetings create an interesting issue. I just received guidance yesterday from the Kansas Attorney General. Absolutely, there's been absolutely nothing that has been implemented that alters the Open Meetings Act. And so I don't have any teeth to tell people they can't come to these meetings, but what we are doing today goes against federal guidance, like us being here with 24 people or however many people in the room, like, we shouldn't be doing this. It's against guidance from several agencies that we have received, or that we've gotten it from. And so, how do you want to handle this? I mean, I do think in talking with Dustin, there are probably ways that we can, have meetings via teleconference and still, I mean, you tell me, Dustin, and you might come up here, but can we effectively have a teleconference and still some way live stream that to the public, or?
I was working with Casey yesterday on the live streaming aspect of this, and we've got some different ideas in place for that. For all of you, one of the things of switching over to your Surface devices is to have the mobility where we can take those, and we'd have to have a brief discussion of what your internet access would be like wherever you are for those services. We can go into Zoom meetings, we can record those, still post those to the internet, we can host that for different public people to be able to join those meetings. We do have ways to do this type of format in an online environment. So, no, I'm not overly concerned about your availability to host this meeting in a virtual environment.
Dustin, you're talking to a guy here that just 3 weeks ago learned how to get on this without your help, bud.
I'll come to
Remember
where,
that.
I'll be to where you are and just stay 6 feet away from you and get you through that.
I think the city commission has respectfully asked the public not to attend their meetings unless they have public comment. And, you know, and I regularly attended their meetings, but all of their meetings are available online, so it's my choice now to no longer actually attend the meetings. I can watch the meetings and get the information that I report to you. So, you know, if we can kind of, I think the meetings are important.
There's
And
gonna
let's-
be, generally, like, time I spent with Alan in the emergency command center and seeing kind of what's in store for us. We look at places like Italy and then the West Coast where they've had it for longer than we have and it's developed. It's gonna be, we've got weeks ahead of us. This is not gonna go away right away. There's gonna be business that we have to accomplish in the coming months. So we're gonna have to have meetings, we're gonna have to process that. I think we could move the duration out. I don't think, we probably need a study session, that's an easy one, but then maybe, we can't decide now because you don't know what's gonna come up, but shoot for bi-weekly meetings, and, I mean, that's something I can work with Derek, and we can just try and, you know, meet as rarely as we can. I'm comfortable with our setup. I think we could do more as far as, like, staff, either scheduling them to come in, which having serial people come in and out isn't a great answer to the public health concern, but also, I mean, there's no reason we couldn't call David and put him on the speakerphone and let him give us his update on the roads and you know, we want to hear from our human resource director, we can dial her up right away and ask her a question, and I mean, I think we could do more too, so we're gonna have to get a budget together, we're gonna have to get an answer for community partners, we're gonna have to process some things just because we have to, so.
I kind of I agree with Derek on the people in the room and all that. But I know there's a couple of counties real close to us that it's no bigger than what we're sitting in right here. I mean, they're overcrowded with 6 people, and we're, you know, lots of rooms, but that's near there and there. But I kind of I don't know, you know, with that one. I feel you did a good job here, the best you could do and what we had, spreading it out. And I still would, I mean, I feel like I'm up there and probably got as much to lose as anybody, but I still think there should be like we're doing right now, at least once every 2 weeks. I mean, you know, I mean, I know, and we could do the other 2 if necessary, just like with Dustin setting us up or whatever, you know, just something. And we can change that anytime we want to. If we deem that's not good, you know.
I think we
Things
could,
get a lot worse, maybe we'd decide once a year or too much, I mean, you know.
I think we could get down to the board and 2 or 3 staff pretty easy, so.
This number of my staff won't be in this room again, I can assure you of that. If we have to put all 5 of you in here, then, and again, I don't believe we have to do that, but I will leave that call up to you, Cole.
I think it's up to the others, I mean, if they,
Well, yeah, up to
I
the
think
board.
it'll change. I think what we say today might change down the road.
Yeah, no, I think it will. I think provided that you all are okay meeting bi-weekly, I don't know that we, and again, if 4 of you are uncomfortable with this, tell me, but historically, I've always worked with the chair, whether has been Commissioner Howard or you, Colt, on agendas and exactly what the meeting looks like. If you're comfortable, like, I don't know that we have to make a decision today on exactly what the meetings will look like unless you want to. But I think we can generally say we're going to meet every other week, and if in 2 weeks this is advanced dramatically, then the understanding is we might do something with technology and a teleconference. I don't think we have to say we're going to today, but if the 4 of you are okay with Colt and I making that determination, depending on how this progresses, then I think we can wait.
We've had commissioners call in before. If somebody doesn't want to be in here, a commissioner, we could do that. I guess my thought, I feel like I need to be here to comply with COMA. We have to have an opportunity for public comment, and we have to have, I don't know how we can have a conference call and give out the phone number to the public and expect that to go well, just so.
Yeah.
Well, I went through that conference call last night with ECAN, and just for the board members, it was difficult. It really couldn't, it really doesn't work too well as far as I can see, teleconferencing.
I'd be comfortable with looking at, putting it off till the April the 1st, and a lot of things can change by then, so, I mean, it's not like you can't cancel that if we need to. We can put it back to that and see where we're at, I guess, to get something with this. I think a lot of it, you're talking about staff here and stuff, I mean, the staff reports are important, but during this time, I mean, I don't know that David needs to be here to tell us that they're hauling rock and blading roads.
Yeah. I can communicate on behalf of my staff.
We've been talking about it for months, so we know where that's at, so.
Yeah.
A lot of that, we can probably get around if we need to get the numbers less in here, so.
Yeah, absolutely. Okay, and a couple of special considerations. One, the Planning Commission. Larry's scheduled to have a Planning Commission meeting tomorrow. Now then, after that, it's only once a month. How do you want to handle that?
I was going to ask you that question.
Do you have a lot of items on the agenda, Larry?
We don't have any major items. I guess the biggest issue that we really have are the people that have already paid their fees for this. We've gone through the public noticing requirement required by state law. In most cases, there's quite a delay because they missed the last meeting for their application. So now they've had to wait till this meeting, in addition to the 21 days it takes to satisfy the notification requirements of state law. So we've had people that have a certain investment that may be pending the decisions of the Planning Commission and ultimately the county commissioners. And to delay these things, it could work some very severe hardship.
that if you do feel like you might come in contact with it, that you do call ahead to get any services. Don't just walk into the doctor's office or the hospital without calling ahead and finding out so that they are prepared for you. And then the last